All right. So, you guys, it's not Monday, it's Wednesday. Happy Wednesday today. And today we have Dr. Katie Kangas. She is not just beautiful, she is brilliant and vibrant and amazing. The San Diego vet. She's got the surfs up attitude.
There you
Absolutely.
go.
Yes, I love San Diego. I love Oceanside. I love all of that. I have mad envy for you. Plus Vista is fun too. So, yes, absolutely. And Dr. Katie has all these new products on the market. So, she's just not a vet. She does online consultations. She is innovative. She has all her little, let me, whoops, get my label
Homeopathics, which
going.
we can talk about, one of my all-time favorite remedies or blends, I should say.
And then I actually, can I say that I use your products
Uh,
personally?
Sure,
Because Dr. Roman
it's nice
gets,
to get personal, feedback and testimonies and experience and, I think that helps people when they know somebody they know is using it and giving them their feedback. So.
and then this is my favorite, the
Yay.
dental.
The
Yeah,
dental is the one product that's not homeopathic, but I'm jumping the gun. I don't know if you want to do any more intro. I don't really need
I
one.
do. I do. I want to say one more thing about you, Dr. Katie, is
Thank you.
you are one of the sweetest vets I know. And the reason why I say that is I watched you at Dr. Judy's try to help so many people. It blew my mind. You were totally like, let me help you with that. I have this, I have that. Like you are the solution guru go
Thank
to. And I was
you. A
just so
lovely
impressed.
title. Thank you.
Yeah, I was totally impressed with you. I was just like, look at her go. And so we have been trying to get together for years, you guys, on this membership. And the time was right. The time is now because you weren't in doing all this cool stuff 2 years ago, even. This is all brand new,
Right. Yeah,
basically.
my product line is all new. I've been wanting to create products for years, and I started with homeopathics mostly, except for my dental product. I will plan to expand into herbals and nutritionals and things like that, but I started with homeopathy, and it's such a beautiful starting place. And I can explain why, but it was also relatively underserved in the pet health space because there's not that many homeopathic lines out there.
You know, I
And
love homeopathy. Like I went to Kingdom College to study acute prescribing homeopathy for animals. And I was like, why didn't I become a homeopathic doctor? What an idiot. Like I spent 2 years studying homeopathy and I could have just gone 2 more years and been a doctor. So I love that about you. Homeopathy is one of my most favorite topics.
oh, I'm so glad. And I can just share with everyone that I have, quite a comprehensive background, in the fact that, of course, I did conventional veterinary medicine for, I graduated veterinary school over 30 years ago. Can't believe I can say that. And I did conventional, I even did shelter medicine. I actually did exotics. I worked in an exotics practice. I've done a lot of different things, even some zoo and wildlife. Then went to the shelter and then got so interested. I'd always been interested in holistic and integrative, but just didn't really know anybody to plug into and to tap into as a mentor. And then my very own doggy at that time in the early 2000s was my inspiration and motivator to go find a mentor. And I did. And then, got certified in acupuncture and, branched from there into herbal and functional medicine. And now I really describe my niche as being functional medicine forward, shall we say.
I
And
love that.
I really kind of root in that as my focused approach, but I bring in Chinese medicine. I certainly do acupuncture, chiropractic, etc. I love herbs, of course. But then there's homeopathy and obviously nutrition and everything. So I think more than some, integrative vets, I really do tie in so many toolboxes. And it's honestly it's an exciting way to practice when you really combine so many aspects to get the strengths of multiple things. And but now I've created these homeopathic products, so I'm even more excited about homeopathy than I was before, because the feedback I get about these products working on a larger scale. I mean, I knew they were working for my clients, or my patients. And nothing works, 100% always, 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 but the majority of feedback I would get was so phenomenal. But then to turn it out on a large scale and have people, tell me and writing us and sending us, messages about how much this is doing for their pets or their human family for that matter, because they're not species specific, which, we can talk about horses and you can give it to chickens, I mean, all kinds of stuff. And that's one of the beautiful things about homeopathy. But now that I'm getting so much feedback, I'm even more jazzed about this modality than even ever before.
That's incredible. So tell me, like, you went to vet school conventional, of course, because that's all we had back then. And where'd you go to school?
University of Wisconsin, which is in Madison. I am from there, so my family's all still back in Milwaukee, Wisconsin, so I go back there frequently. But I graduated there in 1993 and worked in general practice there for a few years, and then I kicked it down to Virginia and worked at did an internship at the Wildlife Center of Virginia, lived in the Blue Ridge Mountains. It was so gorgeous for a few years there. And then I moved to San Diego in 1997. So I've been here for quite a while as well, almost 30 years here, right?
I
Wow.
always thought you were a SoCal native. You're such a blondie, you
Yeah,
know?
and I lost the Wisconsin accent until I go home, and then my don't you knows come out really,
Yeah,
really.
you betcha. I just don't, I have never thought you were a Wisconsin girl.
Yep. So
Amazing.
that's my background, but now I've been doing holistic and integrative, for more than 20 years, and it's just, it continues to be, and we're always forever expanding and learning, and it just continues to be even more and more rewarding as I go.
So
And
now that you do telemedicine more, do you miss, I mean, that means you're not doing chiro or acupuncture or any of those things. Are you missing that?
such a good question, and thank you for asking, because of course, seeing your animal furry, amazing patients in person is such a beautiful connection and exchange in being a veterinarian in this career. But that said, I honestly get so jazzed about the value that I give people in telemedicine, that what I like to tell people is that there are many veterinarians who do acupuncture. There are many, body work, practitioners and professionals, from, canine massage therapists to chiropractors to, PT rehab and acupuncturists, etc. But there aren't many people that do what I do in really getting into the deep dive of what a patient needs, especially when they have a chronic significant health condition, but even in just, preventative care, etc., is what I provide people with: a very customized wellness plan, putting the pieces together when they have multiple vets or certain, specialists. And a lot of times everything is so compartmentalized, and a lot of pet parents get overwhelmed or confused of, how do I put this all together sensibly, and how do I not overuse Western medicine and really tap into the things in, integrative and holistic space that are going to, you know, give the most bang for the buck kind of stuff. And that's what I do. And my appointments are 1 hour. I mean, there's a lot of time that it takes to really serve people and pets well in this type of a service, and almost nobody does that.
That's
So
amazing. I'm
I,
glad that
I get
you
so
you
jazzed that I'm okay with giving up the in-person because I love doing this.
I love that because I know I used to be a equine holistic body worker. I'm a muscle tester, so I used to drive and fly all over the US. And then when COVID hit, I started honing into online. And I don't know if I ever want to go back because it was a lot of work and a lot of stress traveling like that. So I feel kind of the same way. Is Zoom's a really great way to connect.
It is, and when you're working with integrative and holistic modality, it really is, it's a good match. And every day I have people say, thank goodness, Dr. Katie, you do this, because I don't have access to somebody like you near me. And there's very few, even at all, that do that type of comprehensiveness. So yeah,
Very
telemedicine matches it really well, and I just feel blessed and honored that I'm able to do that right now. You know, that's one of the silver linings of our modern technology time, of course.
It
So
is, it is. So let's talk homeopathy. One of my favorite topics is how'd you get into it?
I actually, it was one of the first things that I started training in before I even, just like small courses and et cetera. Before I even got acupuncture certified, I took a weekend homeopathic course and I can't remember the name of the instructor. It was in San Diego. And I was just blown away. I'm like, oh my God, this is amazing. And then, of course, branched into my acupuncture and Chinese medicine and herbs and all that. But I always had my love for homeopathy. And fortunately, my mentor, Dr. Keith Weingart, who was in San Diego at that time, now he's in Oregon, in Portland, Oregon area. He also, even though very rooted in Chinese medicine, he loved homeopathy. And so we had it, and I stepped into his practice and worked alongside of him before I opened my own practice, years later. And he was using homeopathy and had a whole little homeopathic pharmacy. And so I started using it right away from the get-go when I started holistic practice. So I've been using it for, 2 decades at least.
So I'd love to say, try to tell me something homeopathy can't do.
Oh gosh, I don't know of anything it can't do.
I know,
It's just, and that's one of the beautiful things about homeopathy is you can use it to address anything.
just about
It's
anything. Have you
right.
ever been successful with deworming?
I have not used homeopathy for deworming, so I cannot speak to that. Are you familiar with success with
So I
deworming?
have to share with you a quirky story is I have not, but one of my clients was working with a homeopath. Her cat had some really severe issues and she gave it, I think it was Napmir, and this cat puked up 5 liver flukes. And I
Wow.
was like, what
Yeah, not,
the heck?
not a shocker. I just have not used it for that. I've definitely had good success with herbs with deworming,
Yeah.
but homeopathy I've not tapped into for that purpose. So
Yeah, I've always been a little frustrated. I'm like, I don't know. I don't think you can do it. And then that cat did that. And I was like, oh, like I have to figure this out. So I was hoping you had figured it out.
not that piece yet. So
Yeah. But you can use it for anything and everything. Restorative, curative, restorative.
right.
Not so much preventative, but I love no-sodes and sarcodes. Do you do hormone replacement therapy with homeopathy?
I do not use it for
Okay.
that either. Yeah. Yeah.
Okay.
Yeah.
Because we've been talking about that in this group with luteinizing hormone and a sarcode. And I have some testosterone and estrogen sarcodes that I was playing with. I wasn't balancing it with luteinizing hormone, and my dog ended up being like Cujo on the testosterone one. So I learned the hard way on that. Won't do that again.
No, I know that's becoming much more into focus, hormone replacement, et cetera, but that's not something that's in my wheelhouse yet,
Yeah,
for
I
me.
expect it though, and I'm gonna ask you to do that.
Yes,
Because we do iridology in this group, and the endocrine markers are nonstop. And nobody wants to inject with the hormone replacement therapy. Like if we could do it holistically and bypass.
absolutely. That's definitely on the horizon because now it's just getting so much more focused that there's gonna be a lot of data and research and different, product evaluation to figure out what's gonna work.
So I'm going to
It's
give you a
gonna
list
use
of
a lot of.
remedies that I want you to make.
Hey, thank you. Good. I'm gonna put that on my to-do list. I certainly
Excellent.
use a lot of glandulars and focus a lot on systems.
Endocrine. We do our point of like, a lot of vets don't believe in Pleckner, so it's been a really hard conversation for my clients. But what do you think about that?
You can make it and we can make Gigi the guinea pig.
There you go. There's a lot of conversation that we could have about, I mean, the whole endocrine balance, the HPA axis, the hypothalamic pituitary adrenal connection is paramount in, health and obviously in endocrine, balance. And there's so much going on there. chronic stress even feeds it to be like a vicious
Absolutely.
cycle. Obviously, I actually did create a stress form, I have the stress formula in my line, because I have spoken and lectured on stress and even HPA axis, etc. But there's so many things affecting endocrine system, including toxins, including glyphosate, including, and I mean, there's the whole spay neuter topic. I mean, there's so many things that come into play there, but a lot of a lot of nutritional deficiencies, food that's not nutrient dense and truly feeding well, along with toxins, along with stressors, and along with spaying and neutering, etc. It's like, endocrine balance is completely out of whack and crashing. So,
It's an epidemic.
yeah, it really is. It's big.
It's terrifying, actually.
Yeah.
So yes, if you have any mad skills to empower us with, we love that. And everybody's looking for the easiest way to replace what's been stolen.
Right, right. And there, so I, again, glandulars, where we're really feeding those tissues, and I've tapped into standard process a lot, through the years. There's Ancestral Blends is another brand that a lot of, practitioners and pet parents like as well. But feeding those tissues with, with those glands. So giving our pets stuff with, adrenal gland in it, spleen, pituitary, all that kind of stuff,
That's the cool.
is very, very helpful. And that's where, I don't know if we have a lot of standard process users, but I've certainly used that quite a bit through the years. And that really feeds those tissues for not only maintenance, but repair. And then there's also, they even have protomorphogens in there, the PMGs, which are tissue determinants, to try to really turn that gland back online, even if there's an immune mediated condition that has sort of turned it off. So there's a lot of cool stuff to do with just nutritional support. But again, addressing the stress, I guess, addressing nutrient deficiencies. I do, blood testing all the time to check for levels of, magnesium. That alone is an important trace mineral that's often deficient for our pets and for humans, that your adrenal glands can't work well if you are low in magnesium, etc. So again, I check as many markers as possible, help people try to minimize and avoid as many toxicant inputs in their pets, environment, etc., or food. And then, really try to support the endocrine system from many angles, rather than just one approach.
I love that. The multimodal approach.
Yes.
Absolutely. That's so cool. Thank you for sharing that with us. So
Absolutely.
when it comes down to your homeopathic remedies, they're combo remedies. So
Yes.
your commercial remedies are, and so you're taking several different approaches, and just because they're not your one-on-one clients, it's a commercial product, you're trying to kind of eliminate the common causes, because you as a vet have seen patterns.
Yes.
So the
And
pancreatitis, the gallbladder issues, the urinary tract issues.
yeah, and thank you, Poppy, for kind of the way you led into that. It might be helpful to explain to everyone, is that classic homeopathy typically picks one remedy and then, uses that to see, and the hopes, obviously, that one remedy is curative, and where it's assisting the body to shift back into homeostasis and into balance and back into, health. And a lot of, homeopaths know that a lot of times you'll get a shift and symptoms will change, which tells you, which direction the body is going, or which cues you get to then maybe choose another remedy to, either shift in a different direction or keep going. And so there's a lot of little troubleshooting that sometimes has to happen when, using the classic strategies of, you start something and then you may need to, and a lot of classic homeopaths definitely are not thrilled about blends. I mean, there's differing opinions, but I started doing homotoxicology and biotherapeutics and stuff. And I remember PJ Broadfoot, Dr. Broadfoot, and oh, I just lost Rick's last name in my head. It'll come. But they were teaching this course years ago. And that was all about combining homeopathy. And that's what I started doing, years ago, is doing these combo remedies. And I'm telling you, I would get really good clinical success with combo remedies. And the thing is, when you're putting it out, commercially like this, where it's a product where I'm not going to be able to tap into each patient and see, if you start one remedy, what happens, and then do this and this and this. With
Right.
doing a combo that I've seen clinically very helpful and effective, and it's do no harm. I mean, these are not harmful. They're not. And what I love to tell people is the beautiful thing about homeopathy is that there's not a harmful, risk. There's no, real risk in that. It's a very gentle way of nudging the body. I mean, it's all about quantum biology and energetically assisting the body to get back into balance. It's not forcing the body, like a pharmaceutical at, that type of level metabolically and strongly. And so, point being is, one of the great things about homeopathy that it's well known for is its safety. And of course, that's very much why a lot of humans tap into homeopathy for infants, toddlers, babies. A
Pregnancy.
lot of people tell me, yep, I grew up on homeopathy. That's what my parents gave me. So, most people recognize that it is really known for safety, which is great. And I've seen such good results with these combos, these combination formulas, in that when you're not able to track your patients individually, each one, at least we know there's a safe product in their hands that has been, strategically formulated to help the majority of situations that fit this symptom pattern. And I labeled them obviously for symptom patterns. And so that's how it's easy to, for the consumer, the pet parent, to, choose a remedy and see how it's working for their pet. The other beautiful thing, which obviously, Poppy, you're aware, and a lot of people in this group probably are, but that homeopathy, because it's energetic, herbs are amazing and natural, but they're still working more metabolically in the body. I mean, clearly there's energy to everything, but they're still working metabolically, going through the digestive system, creating a specific response in the body. And we know homeopathy absorbs through the mucous membranes, gets, very quickly, instantly into the body, and therefore can work very quickly. And so what I love to tell people is that, there isn't going to be a downside to this remedy or blend for your pet. It's just whether or not it's the perfect match for them. Is it going to, how well is it going to work for them? And sometimes it works moderately well, and sometimes it's game changer well,
Yeah.
Um,
Yeah. I want to elaborate on that point, because there are so many animals with biofilm and gut dysbiosis that my go-to is always first and foremost homeopathy, because you can heal the gut lining without throwing more stuff in there. And here's these people spending like $200 a month on products, feeding it to their horses, their dogs, their cats, plus epic food that's not even getting to the system.
yes.
And homeopathy like cuts to the chase, bypasses that, done.
Yes, I love to tell people it's bypassing the gut. So if your pet has digestive issues, because there's so many pet parents, and I love working with digestive issues, because as everyone knows, the gut is the foundation of our health, the center and core of our health, and nothing in the rest of the body can truly be at optimal health if the gut is in poor health. So we always need to start there. Even in Chinese medicine, we're taught when a patient has a myriad of issues, you got to start with the gut, or you're not going to be able to really, solve problems. So I love working with the gut, and I love to tell my clients, because so many people are like, my pet's GI is so sensitive, or gut is so sensitive, I can't even add, like I add a 16th of, a dose of an herb, and, they seem to react to it. And so one of the great things about homeopathy is it's bypassing the gut. It's the best thing to start with if you have a very sensitive pet, or if they're already on a lot of supplements and you're on supplement overwhelm, and they are, and I love streamlining supplements for people too. But homeopathy is such a beautiful addition, because it's not interfering with anything else, pharmaceutical or herbal or nutritional, and it's bypassing the gut. And so it's very easy on their body to utilize, you know.
Katie, do you mix homeopathy with medication?
Absolutely, because
Yeah.
I have patients on medication all the time. I get a lot of patients with big time issues, and I mean, I seriously look at a patient that's on 12 pharmaceuticals at one time. And I'm
Oh
like,
my gosh, you're
yeah,
kidding me.
yeah, and obviously, in working with me, we're almost always successful in reducing and sometimes completely, like all of them. I mean, sometimes there's some things you can't remove. But that those kinds of circumstances are when it's best to turn to homeopathy
I
because
agree. I
there's so
agree.
much polypharmacy going on. It's like, oh my gosh, if I add even herbs, which are far safer than pharmaceuticals, but there's still some interactions that sometimes are not ideal. But homeopathy, you don't have to worry about it being contraindicated with anything else. So
Absolutely. That is why I love homeopathy. And I love that you can piggyback. There's a couple of them that will antidote sedation or maybe steroids a little bit, but I've not had a big issue with
me
that
either.
at
And
all.
even I'm glad you said that because I do feel that homeopathy is so safe around anesthesia time. Because
Mhm.
again, a lot of anesthesiologists in the veterinary field, I'm sure the human field too, want you to stop a lot, I mean, they don't know much about supplements, so they're just like, stop all supplements 5 to 7 days before surgery because they don't know if anything's going to interfere with surgery or blood flow or bleeding. I mean, even high doses of omega-3s can affect, more
Yeah.
bleeding and clotting times, etc. So basically, they're like, stop everything like several days before surgery, just in case. And I'm gonna tell people, don't gotta stop homeopathy.
Yeah.
And you can give it right after surgery super easily. And so, my nerve formula that I created is great for nerve pain. And so it's wonderful for back pain, neck pain, disc, IVDD, etc. But it's phenomenal for dental pain and post-op dental surgery, or honestly post-op any surgery, because probably nerves have been involved with surgical cutting of anything, but hypericum is in there, which is obviously a superstar with nerve pain, but several other arnicas in there as
Do you have
well.
Staphysagrina?
Yes,
I
so
Staphysagaria. I always say
yeah,
my homeopathics wrong.
yes,
I joke that
so
I'm like the white girl Ricky Ricardo of holistic medicine. Like I always say things a little
yes.
quirky.
So I've seen that formula to be so helpful too. I've even seen it, I've had good feedback. Actually, Dr. Connor Brady gave me feedback that his older doggy with leg tremors, he was using my mobility and the nerve together, and he started with the nerve, and he's like, oh my God, the tremor stopped. He's like, what's in this stuff? Because he didn't
Oh,
know.
I love that.
Yeah.
I'm so glad because I've talked to Connor about homeopathy before and he was kind of like,
Yeah, he didn't know
so
anything. He's like, okay, whatever, because Jessica gave him some products at Feed Real last October, and he took them, back to Ireland and used them, and he was messaging us, and he's like, oh my God, this is working, this is amazing.
I'm
So
so
We need to
glad.
try that on Candy's chewing because I definitely think it's something to do with
actually,
nerves.
Julie, that's a good idea. That's a good idea. And she just had a dental, but yeah, it's a good idea regardless, and see if it makes a
I'll
difference.
tell you more about what happened with her when we're done with all this. Poppy knows the story.
Right
And the
on.
blueberries.
Oh my gosh, what a mess that was. So anyway, back to you. On the homeopathic realm, the trickiest part I've found is dosing. So everybody wants a prescription like aspirin or like a medication or like a supplement twice a day, 3 times a day. How do you deal with that?
Yeah, well, I first tell people that homeopathy is not dose dependent,
Good.
which just blows everyone's mind because nobody has really a frame of reference for that to be true. But, we're also familiar with pharmaceutical medications or over the counter, pharmaceuticals too. Or even herbs, will often have a label that go by weight, for your pet, like how much, this is the dose that you give. And with homeopathy, again, homeopathic remedies are so incredibly diluted already, which obviously lends to the safety and also to the energetic way that they work. But it also means that at that dilution rate, whether you weigh 50 pounds or 250 pounds, it doesn't matter.
It
You
does.
know, energy is energy. It's, working the same. So, and again, this is not, it's not a hinger, but I mean, I've just over the years recommended and still do, on my product label to do like a quarter to a half a dropper full. And so the pellets that we put in there are custom blended with everything that's on the label, is already in those pellets. And then when the, when the consumer, the pet parent, is creating the product to, hydrating the product. And I'll back up and just explain that. Not only was I happy to serve the niche of homeopathy in the pet health space, because there's not that many out there, these products are also sort of innovative and unique in the fact that I believe they're the first product out there that is not based in alcohol or glycerin for a liquid form. Because
Okay.
as we know, homeopathics can come in either pellets or liquid tinctures. And as a liquid tincture, in order for it to be preserved at room temperature, there's either alcohol in there or glycerin. And I found, through the years of working with homeopathy, that typically, especially if you want to give it by mouth and let it absorb into the gums, which is ideal, but it can be put in food, that if the pet tastes the alcohol, especially if it's a cat or a finicky dog, every time they see the bottle after that, they're running from you, and it's a big ordeal.
Well,
And
and I think it shuts down the receptors to receive the homeopathy in a deeper level.
and that's actually a good, I hadn't ever really heard that angle, but a really valid, thought process too, because
I think there's a
shut down.
shock factor to it
True.
that draws the attention
And
off
that
the
can change
action.
the energetics and the receiver, energy. So that is a really great point, Poppy. And so one of the things I love that I'm, so rewarded by with this product line is that people continually tell us how amazing these products are because their pets like them, because they're palatable, because they're water-based. And so the way the products are designed is when we ship them to, when they ship out, it's just the pellets in the amber bottle. And then it says on the label, fill with purified water, whether it's filtered water, spring water, or reverse osmosis water or distilled water, as long as it's not tap water full of toxins, because we don't want the toxins messing with the energetics of the beautiful homeopathy. So clean water, add to the bottle, and then voila, the pellets will dissolve, shake it and succuss it, before you give it, to energetically charge it and just, mix in solution. But we have people literally sending us videos that we get to see their cats come for the drops. Like cats like them, they know, and cats are so energetic. They're like, those are helping me and they don't taste bad, so here I come. And even dogs doing it, little bitty 3-pound dogs, like, yes, give me my. So the palatability is amazing, and that is wonderful. And a lot of people either don't want to use alcohol, or obviously the pets don't want it. And so that's been a wonderful thing about it. And then back to your great question on the dosing is, a quarter dropper full, half a dropper full, right in there. And I just tell people, just, drizzle it on the gums. You can gently lift down a lip or up a lip, or if they just look up at you and their lips are parted already, partly, you can just drizzle it in. And as soon as it enters the inside of the lips, you're done. You don't need to be prying open their mouth and trying to get it down, because the object is not to swallow it, it's just to get contact with the oral mucosa. So, it's generally very easygoing and very low stress for pets, and people love that, and so do I.
So
I have
how
a
long
quick,
does a bottle last? Because
Yes, thank you for saying that. That's the one drawback of not having a preservative in there, is obviously if there was alcohol in there, it would last for months and months at room temperature. So these, we tell people, and there's no like magic date, but I've found through the years of doing this that 3 months is a good mark. It's easy to remember. So that put, clean water in it, and then we recommend store it in the fridge, especially in the summer if your home is, warm. Store it in the fridge and discard it after 3 months. So if you're
okay.
going to continue using a remedy or want it on hand, then it would be, refilled or replaced quarterly, But the great thing about, which I'm sure those pellets, until you add the water, there's almost no shelf. I mean, we have to put like 5 years on the label, but I mean, pellets can last a decade or longer. I mean,
I've fed 20-year-old homeopathic remedies and they were perfect. They
yes.
were like absolutely
So
normal.
we've got to put, maybe we put 3 years on there. I think we put 3 years, but you got to put a date on there. But essentially the pellets before they are, hydrated in any way, I mean, they have phenomenal stability. So anyway, people can hang on to the bottles until they reconstitute them. They can, hang in your first aid kit for, safely for a long, long time. So that's a beautiful thing. And then once they're made up, 3 months, but store them in the fridge. I also love to tell people that if you leave it out, because I've had a couple clients report back to me, oh, I left it on the counter, so I threw it out, I need a new one. I'm like, no, it's not
Oh.
going bad in like 2 days or a day. It's just, if it's weeks, or months out of the fridge, then, I would pitch it. But it's not like it's spoiling pronto. So it does have some stability, but not long-term stability.
Okay,
So excited
Question.
that somebody, sorry, I'm so excited that somebody else does that.
I know.
That
It's
when
good.
you give it, that when you give your clients the remedies, it's dry in a bottle, ready to be mixed. And what I tell my clients is that
So
if you keep it in the refrigerator and it stays clear, then you can continue using it. If you see in the slightest bit of residue in there, or it starts getting a little cloudy, then it's time to throw it away.
Thank you. Yes, if it gets like murky on the
Yes.
even like sticky, where if you don't, when you shake it, it's not immediately, that uniform color. If it's still like there's solidifying something in there, then that's when it's off. Thank you.
that is Janice Doyle. She is an actual homeopath, nurse, human.
Oh my
pet
goodness.
homeopath.
Yay.
She's my group advisor.
Okay, phenomenal. Well, I know there's so much you can contribute to this conversation, and you may be, using homeopathy longer or more than I have, so I'm always open to input. But thank you for giving that input, because that was
I'm getting chills. I'm just getting chills while you're talking, because every time we talk about homeopathy, it's just it's so exciting, and the more that people can teach, like you're doing right now, the more people absorb, and the more it gets spread around, and that's just so exciting.
Janice, you were actually on the national board, right?
I was on the God, brain fart. The Center for Classical Homeopathy
board.
Yeah, I was on the board. Yeah, and
Yeah.
I'm H certified.
Wow, amazing.
Yes,
Fantastic.
very exciting. Yes, so we all jam to homeopathy. We get ridiculously excited about it because we love it. It's so effective, and we want the whole world to know about homeopathy.
Yeah.
So
Okay,
great.
so I have 2 questions. When it goes in the fridge, do you have to succoust it afterwards?
Great.
Every time you go to give it?
Yes, I recommend
Okay.
doing that. Yep.
Okay, and the other question is, I just took 2 homeopathic courses, actually. Andrea Rings, I got certified, well, not certified, but certified. And then another one. Is there an advantage pellets versus diluting with the water, or it's just as effective?
I don't, and I'd love to hear from the other, homeopathic experts in the group, but I think it's just as effective. I mean, I've seen it clinically effective given in that format for years and years. So, and I think a lot of times, the ease of giving it to a pet in that format, it can be the game changer of them getting the response, as opposed to people trying to put the pellets in and them rolling out and getting stuck on them or the outside of the lip, and etc. But not to say that you can definitely give pellets, obviously. So whatever format people have and feel comfortable using, I think they're equally effective.
Okay.
Dr. Katie, I have to tell you that one of my students does an inhalation.
Yeah, we know. I know people who've done that. There are actually experts around the world who are doing that right now to help with COVID, with long-term COVID, to try and get rid of it. They use olfactory
Homeopathic inhalation. Yeah.
Okay.
Isn't that amazing?
It is amazing.
I have never done that, but I've exposed, like through muscle testing, homeopathic remedies to animals and watched them actually respond to the suggestion of the remedy and watch the remedy work just off suggestion.
Yeah, it depends on how sensitive somebody is. I definitely have seen that. I've definitely seen somebody start responding to the remedy in the interview process, because a lot of it is about intention.
What? Yes, and there's that too. That is amazing.
And they started
Wow.
doing it that. But the one thing that I love about giving it in water is that, you know, if you give a pellet, it's not a general caution, but homeopaths deal in many different potencies. So when you're giving a higher potency, there's a potential for a reaction. It's not a reaction like side effects. It's just your symptoms may get a little bit worse before they get better. And
Yeah.
that's an aggravation. And anytime I've diluted it, and that's why now I give all of my clients water-based remedy.
Oh, good. So
Never-
the aggravation is less likely to occur in a water given format.
Yes, and you can also you can also control the amount a little bit more, because if you put it in water and you say, okay, give a dropper full, you know, once a day for a couple days, and they start having an aggravation, say, okay, go down to a drop. You know, and I've seen less of an aggravation with that, so it helps me control my
Is that
a bit better.
super easy to titrate when it's in the dropper form like that?
Absolutely, yeah.
Yep. And
That's so exciting. Janice, I love how excited you are.
I know it's
She's
So
like,
that makes me wonder with candy, with the calciphos, if I hadn't done the one pellet, if I had done the liquid and titrated, if it would have made a difference. What happened was a couple of people told me use calciphos 1M to push her baby tooth it was loose down at West Palm when we were all there, and it's never came out, and that's what started this whole thing. So I gave her the one pellet. Well, I gave her two, but she spit one out of the calciphos,
so
and
I
like
only want one. I only need one.
3 days later, all of a sudden this phantom chewing started with, you know, chattering teeth and like quivering lips and grinding her teeth with like TMJ. There were some things that led up to it, but it just really escalated. And I kept saying, I think it worked on something else under the gum, like a hidden baby tooth, and was pushing it out, pushed it on a nerve, and she's trying to get it out. Well, he found two baby teeth that no, I'm telling you, 8 different vets looked at it. Josie looked at it at Global. Jerry Bukoff looked at her mouth. My 3 Holistic, Dr. Shea, everybody looked at her mouth. Nobody saw those 2 baby teeth. So I wonder if the calciphos had pushed that out and started everything, but it never pushed it out far enough. And if I had done the drops, if I would have gotten rid of the tooth I was aiming to get out, which is probably a good thing that it did what it did, because she got her dental and got them removed.
Right, that's what I was thinking, is that at least it assisted you to go in the direction that, you know, she needed. So that's great.
But I mean, it was crazy. And I wonder if the liquids would have made a difference.
Kimberly has a question. Do you want to ask your question?
I just wanted to say an easy way to succuss it is my holistic vet, Dr. Nard. We use a mantra, and when I succuss, we are the vibration of infinite love and gratitude. And then you know that you've said it, you've succussed enough. So
Wow, thank you for contributing that. I
Yeah.
absolutely love that.
yeah,
Will you say that one more time, Kimberly?
we are the vibration of infinite love and gratitude.
Awesome.
And that just goes right in hand with the moto's work, that you're imprinting the water as you're using your energetic homeopathy. That's pretty cool.
Yeah.
And we use a lot of Poppy knows we use a lot of homeopathy here at home for Wave. And I know you were smiling earlier that because he was trying to photobomb.
That's great. Thank you for that, Kimberly.
Kimberly has an amazing story. Kimberly, do you want to share your story?
I can. I'm super excited for tomorrow. So, Dr. Kangas, I have a almost 10-year-old golden retriever who was diagnosed with T-zone lymphoma 34 months ago. And what we've done is nothing pharmacologically, nothing oncologically. I work with Dr. Betsy Hershey here in Phoenix, and she's amazing. And I met Peter Cyan-Corelli online. And so because of him, I know Poppy, I now know Dr. Roman, I now know Dr. you, and we have been successful. And his lymphocyte count, the highest it was 5780. And because of Poppy, we started using Lithicin, and then we started doing ozonated glycerin about 2 months ago, and his last blood test was about 3 weeks ago or so, and his lymphocyte count went down to 5640. But now I got the MBRT today, Poppy. That was a very expensive poop. There was another word I want to use, but I want to be PC. And so we're doing FMT with the MBRT G7 tomorrow with ozone for wave. And he's on a host of mushrooms and all natural supplements. But one of the things my holistic vet did was the poly MVA. She made a homeopathic remedy from it. So, and we do a custom homotox, and then we do carcinosin is the other homeopathic remedy that we use as well. So, but he's doing really good. I mean, he's amazing. He's got great energy. He wrestles with his son, and I'm really excited about these next steps. I bought a generator from Jonathan Lowe, and Dr. Hershey's going to train me tomorrow how to do rectal insufflation. So,
well, and you can
own
do it to
ozone.
yourself.
Yep, ozone generator. What kind of doggy is Wave?
he's a golden retriever.
Oh,
He's my grand champion.
over 30 months, 30 some months.
Isn't
34.
that amazing?
That is astounding. Phenomenal.
So,
Wow, Kimberly, that just gave me such feel good chills and happiness and everything. So congratulations.
oh,
And
thank you.
tomorrow's another, good step in the whole, process. So good for
Right.
you.
My goal is to kick this cancer, and I'm very intentional when I say this for Poppy, versus another word that drops the T. So, yeah, even Dr. Hershey said that normally is about 8 to 20 months for T zone because it's indolent. So she keeps saying we're in an uncharted territory. But my hope is that we can kick this down the road and also solve some of his noise problems as well. He's got really deep fears of noise. He had a bad experience at a dog show when he was 15 months and during the last fear period. But
Kimberly, I'm going to stop you. I want to ask Dr. Kangas about this. Is metastasis is often related to trauma, right? Do you feel that way? And homeopathy is so amazing on the mental state.
There's a lot of energetics behind cancer. I don't know if trauma is the only, certainly that
Right.
I agree with you. I've heard a lot of human experts too say that, cancer can tap in a lot with resentment, unresolved things, emotions, etc. So, but that's emotional trauma. There's so much that you could put into, the discussion of trauma. So I 100% agree. And as you said, homeopathy works with that so specifically and so well, that it's a very good match. So
Yeah.
carcinosin I've used in the past too, and I know that Kimberly's using that. That's really great.
Yeah. Maybe you need a trauma blend. I'm just going to write up all your new blends that are to be released soon.
I love that. Give me a wish list. And so that'll give me some inspiration for my line expansion.
There's a
Yeah,
panic. Oh, sorry.
So Janice, all of you that have a wish list that you want Dr. Katie Kangas to create, you heard it. You heard it.
Well, there's a panic blend that I've used that has been extremely helpful in dogs that have problems with noise and dogs that have problems going to the vet. And I think it might be very useful just to have it commercially available. I have to think of all the remedies in it though. There's only 3 remedies in it, but it's aconite, argentum nitricum, and arsenicum.
Yeah, and I have similar in my stress as well.
Yeah, it works beautifully.
Yep, so, and I've seen it work really well too. I get a lot of feedback for, different stress related things, but
Oh,
yeah,
yeah,
I
people
have
will
that one.
people will pay a ton of money for that.
yeah.
So for 4th of July, is this our
Yes,
go-to?
actually, that's a great 4th of July. Yep. And I just had someone just last week report back that she's actually a friend of mine, and her little Jack Russell Terrier mix does not travel well in the car and does not do well with vet visits. And she has literally tried everything from, CBDs and flower essences and essential oils and all of that for his travel, and even pharmaceuticals, and he doesn't do well with those either. And she just got my stress formula, and she reported back, she's like, oh my God, not only did he do okay with the car ride, but she's like, he went to the vet and he went back there and had his anal glands done, and he comes out and he's like fine, and everyone at the vet hospital was amazed. And so yeah, so that was a really fun feedback too.
That's
Yeah. And my understanding is that in particular in lymphoma, it's deeply rooted in emotional disorders. So I'm glad that we were able to stop it, that it's not the aggressive kind, because I've had that before in my previous golden, his former housemate. But I'm grateful for all the progress that he's made, and the goal for him is just to live his best life. So
But Dr. Katie, I believe you're right, is the terrain, the physical terrain, the mental terrain, and esoterically, the spiritual terrain, all create a whole. And that's the beauty of holistic, but that's the beauty of homeopathy. Homeopathy like addresses all the levels.
Yes, well said. I mean, just perfectly said. It
What
does.
I thought was really crazy is how during COVID, how they built these homeless shelters for those people who were going to get COVID, and homeless people never got COVID because their mental emotional state was so low, they didn't vibrate with the actual disease. They might have caught it, but they didn't manifest the illness. And so when they were like announcing they're going to take in all these homeless people, I was just like, oh, we'll see how that goes because they're not going to get it. And they didn't.
Interesting reflection and example, very.
Yeah.
Yeah, we were caught up in all the energetics of, the world, et cetera, being kind of, out of that, not plugged in that manner. So that probably was very much in their favor.
I know, exactly. They were out of the loop, out of
Exactly.
the fear loop.
For being out of the loop.
But also their mental state, it was so focused on their just surviving
Mhm.
that their body never recognized it.
Yeah, so fascinating.
Isn't it crazy? So when I read that in homeopathic school, I was married to a man who was genetically schizophrenic. I didn't know it at the time, but stress triggered that. And schizophrenics in I think it was one of the normal human homeopathic textbooks. And they said that mentally ill don't get sick. And he never got sick. So one day he actually got sick, and I was like, yes. And he was just like miserable. He's all, I never get sick. I'm like, oh my gosh, this is the best day ever. Yeah. Isn't that wild?
Very interesting, very wild, yeah.
Yeah. Charlene, I saw that you had a question. Are you vanished? Did you remove yourself? And then Susan Fletcher Scott in Facebook also wanted to ask something. I don't know what that is. I'm trying to follow the thread on Facebook. Oh, well. Anybody else have any awesome additional comments to this? So Dr. Katie, stress, 4th of July.
Yeah, it would be a very good match for 4th of July.
How would you administer it?
You can do it in advance before, in fact, I think somebody just put that up, thank you. You can do it in advance before, you know, to help the balancing of the body before, you know, the stressor trigger occurs. And then, you know, give it obviously, you know, after any trigger happens as well. I mean, that's the other nice thing about homeopathic remedies. You did ask about frequency before. And, you know, frequency of giving it can, you know, really be variable, of course, for the sensitivity of the individual, the needs, you know, the current circumstances. But one of the things that I've often done through the years with my pet, you know, patients is loading doses. And so if there's an immediate situation going on, an immediate, you know, bug bite, bee sting reaction, you know, even like upset stomach, you know, vomiting, is that you can do a loading dose every, you know, 15 minutes for 10 or 15 minutes for 3 doses to really just get that going in the body at, you know, a good level immediately. And I've seen such good results with that. So even
I
with
do the same.
yeah, good.
I do the multi-dose method for the
Yeah.
first 3 doses. I kind of have a rule of 3. If it doesn't
That's
resonate,
what I usually do too. Is
yeah.
so,
This
but
is such an exciting conversation. And the other thing that makes it so safe is that, you know, my rule for my clients is if you try something and it doesn't work, you know, you can try it 2 more times. And if it still doesn't work, then stop.
Yeah.
If you're using something and you want to know whether or not to continue it, you just look at the symptoms. Are the symptoms still there? No. If they're not, then stop it. If they come back, then start it again. If they're still there, then continue it. You know, it's very simple, basic common sense.
that's phenomenal. Thank you for contributing that, because it's basic common sense, but a lot of people don't know that, or
Right.
you know, just doesn't come inherently to them to recognize that.
Well,
And
because
so-
they've been trained by the pharmaceutical industry.
right, that's true.
But also,
That's true.
we as Americans, if it works, we want more.
Yeah. Yes.
And
Yeah.
I tell everybody, I'm like, I have to deprogram you guys. If it's working, you wait. And they're like, no. Yeah. We just want to go like, yes, it worked.
Exactly. So thank you for contributing that, because that's such a good guideline for everybody and a very succinct delivery. It's perfect.
Yes, it is exciting. I love that you're excited too, Janice.
Me
That's so fun. So Dr. Katie, I'm grateful that you do the multi-dose method in an emergency situation. If it doesn't work, what would you suggest? Just rolling into another remedy, or
Yes.
organizing it
Yeah,
more, or
you know, and depending, I mean, if you get some reduction, but not total resolution, I mean, you can still give it in, you know, less frequent manner after that. You know, some of my remedies, you know, I tell people twice a day or once a day, or, you know, depending, and, you know, I kind of have a standard bottle label recommendation, but when I'm working with people one-on-one, I, you know, customize my recommendations for, you know, knowing their pet. But yeah, if it's working to some extent, but not completely resolved, then I would continue dosing, not at that loading fashion for, you know, beyond 3 perhaps. But turning into another remedy or layering in something else too. So, you know, layering in your flower essences or your essential oils or your, you know, nutritional, I mean, it depends on the situation, but, you know, I like to combine multimodal kind of a gal.
so antidoting. Let's talk about antidoting. Is there anything we shouldn't be doing with the remedies, like microwave or coffee or anything like that, or no problem?
Meaning coffee. So you're talking for the human side or?
Or that, like, all my clients seem to put this next to their essential oils, or
Oh,
they
I
put
see what
it
you're
next
saying.
to
'Cause I'm like,
their.
microwave. Nobody's putting that in the microwave, right? I'm like, what? You
It's
mean like
always like
even near the
stored near
microwave?
the microwave
No,
You
on
have
it.
to keep it away from EMFs and everything
That's what
because
I just realized what you must be getting at. Thank you very much. Yeah, keeping it away because we know it's vibrational, we know it's energetic. So EMFs and, you know, all these, you know, unnatural wavelengths and etc., are definitely disruptors as well. So we want as little disruption as possible. So that's a really good point, is not putting them next to or at the close vicinity of something that could alter the vibration.
So
Yeah.
here's a quick question. With me using all my red light all the time, would that throw it off? Because would that be work like an EMF or a vibration or an energetic? Probably, right?
Good question. I don't think it would throw it off. I don't know if anybody's seen any data on that. I haven't seen or read anything
I have
on
to
it.
ask.
But just knowing, I mean, I wouldn't put the laser right on the bottle. I don't know what that light, wavelength would do to it, but I would think if it's in the vicinity of it,
I mean, they're not, but I'm doing red light on the girls right now. So
Yeah.
I'm like, it just made me think of it.
yeah, that's a good question. I don't know if there's any
I'll ask Jackie.
evaluation.
I've used it with I've used red light with homeopathics. They seem to enhance it. I think, you just have to be careful how
Yeah,
you're,
Just
what
has to
I
have
was
the
thinking.
bottle near
because it's
the
it
device.
like,
We just enhance it. I was
oh,
actually.
you mean the bottle near it, Jay?
Yeah.
Oh, no.
Like,
Mm.
No,
yeah.
homeopathic remedies are not that fragile. It used to be that everybody used to cover their homeopathic remedies before they went into the X-ray in the airports. No,
Right.
I don't know anybody who does that anymore. And the remedies still last. There are people out there who have had remedies, that are like 50 years old, and they have no idea how they were stored, no idea if they were exposed to heat, no idea if they were exposed to radiation,
Mhm.
and the remedies still work. So the
Yeah.
thing there is you just try it and see if it works.
Yeah.
If it doesn't work, throw it
I
out.
love that.
I
We were
actually
we were-
think it's a good doing it with the red light is a great companion. Like they work well together.
Exponentially.
oh yeah,
Yeah.
absolutely on that. I was just
Yeah.
asking about the store,
Yeah, I
if the
understand.
bottle gets near it. We were talking about it yesterday in the class I was in. The woman keeps her kits in her car for 20 years now, and they're still fine.
Oh,
Even
yeah.
in the
Yeah.
heat.
Even hot in the
Yeah,
car?
she's in the
What?
UK, and I asked her.
Well,
I
it's
said,
not that hot in the
I have
UK.
an emergency kit in my car. I had an emergency kit in my car for 15 years. In the console in the car, it's my emergency kit. So they're all 200C remedies. They've never not worked.
Oh, that's
Yeah,
so.
because I
I'm
was wondering,
shocked.
with the heat,
I'm
if it would throw it
shocked.
off.
See,
What? They're very strong.
talk about stability. Oh, that's incredible.
That is incredible, you guys. I am so impressed. The UK I could understand, but yeah.
Yeah, but it still gets hot enough, to be, and cars get really hot. I mean,
Yeah,
and I said to her, what
like-
about me keeping it in Florida? She said, it should be a problem. I'm like, okay.
Okay, Susan on Facebook is saying her 12-year-old Ridgeback Rescue has nasal cancer for almost 2 years, doing well on Chinese herbal product and raised right. Biggest concern right now is congestion at night and helping him lose weight due to low T3. What do you think? That's a complicated answer.
Yeah, I was just gonna say, can you?
There's no easy answer.
Right, that's difficult to get into. I would love to be a little more focused for, somebody personally, if they want to meet with me,
Yeah.
on telemedicine, but yeah, I think that's a little bit difficult to dive into here.
Yeah, that's complex, because even better would be to reduce that nasal cancer that's causing that congestion. So I'm gonna say maybe nebulizing ozone. I don't know.
Yeah, ozone for cancer, mushrooms for cancer. I mean, you can work on, things that support congestion, but if there's an occupying mass in there, I mean, there's a lot of depth in that discussion.
Yeah, absolutely. Susan, contact Katie
Yes,
Kangas.
please.
Yeah.
Yes,
Text her, call her, whatever. How do we get a hold of you? You're so busy.
well, Jessica's I like to call her my handler. Jessica's my handler. She is my practice manager. She's also my product partner in Dr. Katie's Remedies. She has helped me launch this on so many amazing angles. She is phenomenal. And so going through her is always good. As far as my practice, then,
Yeah.
you know, going through my practice, which people may end up talking with Jessica, but I have 2 other team members that do, you know, customer service and scheduling and answering people's questions, fielding people's questions when they call or email or text us. So my website for my practice is itsvetcare.com. My product, which you can find my practice through my product website, but that's drkadies.com, and it's Katie Kangas on social media. So,
Okay.
you know, they can find us through social, they can find us through our product site, and then, you know, if they want to plug into my clinical practice services, then I'm happy for that too.
Now, Dr. Katie, I hear you're starting a podcast.
I am. Thank you so much. Yeah, that's really exciting. And Clayton Payne of the Pet Business Disruptors, I mentioned him, you know, out of the UK. He is my co-host. So it is fun. We have filmed 10 or 12 episodes already. Our launch date will be in July. We don't know exactly when, but coming up soon. And then we'll drop weekly, you know, weekly dates. And it is gonna be awesome. I mean, it's so fun because not only with his personality and his, you know, his presence and his accent and everything, it's just like a fun conversation, energetic about it, but also his knowledge in the pet health space and the business side of things, the history side of things behind foods and products. He knows, like I bring in like the medical, you know, and clinical, and he brings in so much more that's beyond my scope. And so it really adds for all the lists. Like I learn when I'm, you know, he thought he was going to be interviewing me, and I started interviewing him because I'm like, wait, you have so much to offer. So
That's fun.
it's gonna be really great for people.
When does that launch?
We were shooting for July 1, but it may be mid-July. So stay tuned.
Okay,
So,
let us know. I'll let the group know.
thank you.
Yeah, we'll like drive your
That's the
algorithm
catch.
up. We'll be
You
your
don't have to
algorithm
pay,
drivers.
so
No,
Yeah.
yeah,
can-
you don't need bots. You got us.
Thank you. Thank you.
Yeah.
Thank you.
And then also, do you do any courses, classes, anything like that? Like I've caught some of your dental interviews. What
Thank you.
I love them.
Thank you. I started, Poppy, that's so cool that you asked, because that was my vision, was to do a lot of those. And I started what we were calling workshops, because we would have forums like this on Zoom where people could ask Q&A after I did a little PowerPoint, because I love just talking, but I also love showing people images and slides, because a picture can, you know, it's worth 1,000 words. Like you can really get an understanding of something so I love giving webinars and giving presentations, etc. And I started doing those, and we did several of them. Maybe that's, you know, one of the few you caught. We did dental and GI, gut health, and allergy. But then, you know, I didn't keep those up, and I don't know how much
You
demand we had for
you
them.
should create a portal and just have like a $5 purchase.
Thank you for that. More wish list, good stuff.
There you go. We're going to get your little courses done. And I have to
Yeah.
say, in this membership, people are always asking me, where can I go to homeopathic school? Where can I learn more about animal homeopathy? Would you do anything like that?
Perhaps
Okay.
I mean, I love teaching and you know, contributing and honestly networking and working with people to, you know, I learn as I teach and contribute, and so it's always such a nice exchange. So I'm glad you brought that up, because that may, you know, inspire or align the stars to somehow bring that together at some point. So thank you.
Yeah, I'm kind of excited, Dr. Katie. I really think you could probably do like a webinar on all your products and get people to be educated and represent and help their clients out with your product line. So if you train them,
Mhm.
that would be really cool.
Thank you for thinking of that. I
Yeah.
love it.
All right. And you're going to be live speaking at HVMA in October, but also Feed Real, right?
I am not speaking at Feed Real, although I haven't. Sometimes I end up popping into a lab at the, later on the schedule or whatever. So we'll see. I haven't spoken to Ruby. I thought about asking her about that, but I'm not slated to do one of the main stage talks. So,
Okay.
but
And will you be a vendor?
oh, that's a good question. I don't know. So I will find out with Jessica if we're doing that.
Okay, great. And then you're going to be at Super Zoo.
We will be at Super Zoo, and we will likely, I believe our products will be in Clayton Payne's booth with Oldfield. So
And then if you want to party, are you going to the Two Crazy Cat Ladies?
absolutely.
Girl, I will go to Vegas for that. I don't know if I'll
Right?
go to Super Zoo though.
Right? Yeah.
I'll have to take your stress product before Super Zoo. Oh my God. If you guys have
That's
ever been
okay.
to Super Zoo, it is overwhelming.
Yeah, it is.
Yeah.
It's fun though. It's good. It's such good networking and meeting such great people. But I will absolutely be at Two Crazy Cat Lady at Jay and Adrian's party, and I'm so glad you'll be there. We'll get
Yeah.
to
Vegas,
connect in
baby.
person.
We're
Yeah.
going to Vegas.
Woo-hoo.
Just in the hottest part of the time for
Right,
Vegas.
exactly. Yeah. How appropriate.
All right. Any other questions before we wrap it up today?
I have a quick one.
I knew it. Let me change the screen. Okay. Show your beautiful faces.
Who, me?
Yeah.
So with Candy, when she had her surgery with the CBD, and she was getting aconite and hypericum and arnica. I was using go-to spray because it's
Yeah.
200C.
Great. Yeah.
So how do I have to space it apart from the CBD, or can I do them back to back? I wasn't sure, so I was spacing them out.
Yeah, I think you can do them back to back. I
Okay.
don't think you need to space them. What's interesting though, Julie, is that originally I was hearing and learning from cannabinoid experts that putting CBD directly on the gums or in the mouth was better for absorption. Now everybody's saying nope, it's better in food.
Well, it's
So
interesting because my vet moved me over to LVET, and it says to give it with food. And
yeah,
I noticed that Candy, when I didn't, I was trying to do it before bed so she would have the pain relief and sleep through the night. She started acid refluxing.
when you put it in the food.
No, when I did it at night versus at
Gotcha.
dinner. So I went back to dinner and
Okay.
we're good.
Interesting, but for absorption, and Dr. Trina Hazah, I don't know if anyone was at Feed Real last year, she spoke, but Dr. Trina Hazah is a board certified integrative veterinary oncologist and a cannabis expert. And so she also said in her talk that she recommends giving it with food. And
So I might do that.
yeah,
Okay.
I don't think you can get anybody with too much more credible current research, to vouch for that. So that's what I'm recommending now too.
Okay, that's good to
So
know.
then, then it would be spaced out from your homeopathy even a little more naturally, and so that's kind of nice.
That's awesome.
think it's
Anybody
critical.
else? Donna? Donna?
Dr.
Hi.
Katie.
So-
Dr. Katie. Oh, go ahead, Don. I'm sorry.
Oh, sorry. My question is about the CBD. The stuff you're talking about, is it with THC or without THC?
Either. Now that said, a lot of the formulations that, one of the brands that Dr. Hazah is like one of her favorite brands is Right Ratio. And they actually do have a little bit of THC in their formulas because we know that cannabinoids synergize each other and that a little bit of THC actually helps to potentiate CBD efficacy.
Mhm.
And so she was speaking, I think she was speaking in general, but she was very specifically talking about some of those formulas with THC in it.
Okay.
But I believe that it's now being recommended to give CBD with food. So as a
Because I learned from Dr. Rob Silver back in the day, and I was using a formula with THC, putting it in the gums, and it works within 10 minutes. whereas in
Wow.
the food, it takes almost an hour.
Yeah,
So
I
how, what
don't
do you,
know, and again, there may not be, obviously strict margins on the accuracy of these opinions, but I told people to give CBD by mouth for years, but now I've heard opinions changing. Whether obviously you saw it work quicker, that makes sense when you're giving
yeah,
it by mouth, but I don't know if it gets better full absorption when it does go in with food. Maybe it works quicker without, but maybe the absorption is more full and complete the other way. I'm not sure. But obviously, Dr. Rob Silver is also a cannabinoid expert, so
yeah,
he's a good person to tap into for any data around that too. So
Well, I've been distributing CBD for God, I don't know, since 15. And when I sell it to a consumer, I mean, okay, so as you said, the woman who, Donna, so yeah, if you give it with or as food, or like a cookie or a treat or something, or yeah, then that's going to take, it's like food, right? It's going to take half an hour to kick in. And if you do oils or creams, like I sell treatables and I sell Canna Companion and I sell New Leaf. So the Canna Companion is a capsule and they have oils. So you can do oral, you can do,
right on the gum line.
What's that?
On the gum line, right?
Yeah, exactly. And then, and that, like, treatables has a cream and you put it, in the ear, like, in the skin part, not way in, but just on the top where the skin is. And it takes with our Malamute, it used to take like 7 minutes to kick in. Like Storms, it was 7 minutes. So
that's been my experience too.
Yeah, so I suggest both, topical or in food or just handing it to them as a treat. If you want to put it on their food, that's up to you, but you don't have to.
right.
With my clients, I suggest it for a storm. A storm's coming, get it on their gums. It's going to kick in much sooner for storms.
Yeah.
Or if a dog is in the middle of a seizure, get it on the gums.
Yeah, but absolutely that makes
Do you
sense.
guys ever acupressure with CBD?
Oh, that's a good thought though.
Yeah.
I like that.
Monique, hop in there, girl. You've been patient.
Oh, no worries. I just wanted to know, is there I just asked with Pam, is there a full body detox, like a systemic detox? Or it's I know you have the rabies one and all of that. My kittens, they've been through the ringer since I've gotten them. So I just wanted to know if there was something like that. And does the stuff for the gut, what is that for? I have a mega colon cat that has issues.
Yeah, so the tummy form, does your mega colon cat, I mean, there's a lot we can do for mega colon too, but does your mega colon cat have specific symptoms? Like, is there any upper GI symptoms happening? Is there a lot of different things?
Only when she's backed up
Okay,
does she projectile vomit, and that's how I know. That's
yeah,
my tell,
the
which
cancer.
actually happened the other day.
Okay.
So
So yeah, the tummy formula is my one that has the most, remedies in that. A lot of them have 4 or 5. I think I have at least 8 in my tummy remedy, but there are things that will help with motility, with cramping, with, backing up as well. So definitely with nausea. I mean, I love to tell people, I think my tummy remedy shines with upper GI issues, but it definitely is helpful for middle gut, small intestine and large intestine colon as well. So lycopodium in there, bloating, gas, cholesynthesis, abdominal cramping, there's a lot of good stuff that it's such a good overall symptom support catch-all, and I've had such good success with that remedy. So I'd encourage you to try it, to use it for your kitty. Megacolon would be a good match too.
okay. And the other one was about the detox, is the rabies vaccine detox. Is that
So there's so that one is very, so that's we call Vetox R is very
Yeah.
specific for rabies. And then my general detox support is the Vetox, which we named it Vetox short for vaccine detox, because that's one of the reasons people are avidly looking for detox a lot, but it is just a general systemic, detox support remedy. So that's the one you want to choose, not the Vetox R, because that's very specific for, post-rabies vaccine. So the Vetox has the Thuja, the silica, the arnica, and the gallium in it. So that's really good for, the lymphatic drainage and, just a deeper but gentle detoxification support. So
Okay.
Dr.
Yeah.
Katie, how long would you do that post-vaccine or pre and post-vaccine?
yeah, you can start it pre,
Okay.
but you don't necessarily, need to, but you can absolutely start it pre. And I like to recommend the Vetox. Well, just to answer your question, Poppy, I would do it for 7 days, 5 to 7 days post-vaccination. But you could use it for up to, maybe 2 weeks straight and then pulse it if you're using it for more general detox. Overall, I like to recommend it for after, anesthetics or pharmaceuticals have been used. Certainly if people have to tap into flea and tick chemicals and products. If you know that your neighbor, your area just sprayed glyphosate or, whatever chemical exposures, anesthesias, medicines, whatever, it's, a good match for any of that. So, and then I would use it for maybe 2 weeks at a time and then pause it, whether it's for a month and, use it again, or whether it's for a season quarterly, that can be variable.
And Dr.
Vetox or Vetox R
The Vetox R, I would only use very specifically for like
for
3 to 4
rabies.
days after a rabies vaccine, and then you're done.
Okay, because
And
I
is
have
that-
that. I was thinking of candy and the anesthesia, though I think we detoxed it already.
So let's say we haven't given vaccines for years, but there were rescue dogs that probably got triple vaccinated and they are not right mentally. Just
I love
saying.
that you're asking, because I always tell people that a detox support can help whether they were vaccinated years ago or recently. So
Right.
just because it may be years ago doesn't mean that it's not going to be helping the body. It definitely will be, because, a lot of stuff is, latent deeply in the matrix and the lymphatics, etc. And again, working at such an energetic level, I mean, some of this stuff has been hanging out in the body for a long time.
Excellent. Vicky with the cat.
Thank you, Poppy. Sorry, I'm at work, so I'm not able to show my face. Hi, Dr. Katie. I have a case study on hand right now from a cat breeder. I just want to see if you have any suggestion from the homeopathy side. That there is a kitten. Now is 2 weeks old, I think. He is having cat puke on the side since he was 2 days old. Until now, seems there's no improvement. It is quite popular sometimes. The kitten happened from a raw feed mom. So we normally try to use the vitamin B supplement injection for to help them. But I want to see if there's any homeopathy we can do some supporting to this kitten, because we know homeopathy is safe for the pregnancy, also for the kitten. So I just want to see and learn.
And I'm sorry, Vicky, I feel like did you guys miss some of that? I feel like she was a little.
Yeah, Vicky's in Hong Kong.
Oh, sorry, Vicky. So I understood, pregnant moms, kittens, are you looking for like immune support or just general, like, I don't know if I got like sort of the targeted part of the question.
I think we are having the B12 injection to do some supporting or supplement on the kittens. Hopefully can help the head resume back to normal. Because most of the case can be helpful with the B12 injection. But just want to see if there's anything we can use from the homeopathy side for the kitten.
Yeah, that's
Vicky,
such a broad, like, I love B12. Don't get, I mean that, B12 is such a good, supportive, easygoing vitamin because it helps the body with energy and, mitochondria use, etc. But comparing that to homeopathy, I'm not sure what I would suggest. What I would say is, at least from my line, something like the immune blend would make sense. I do have an immune blend, which would be very good for the cats and, for the kittens and for the mom, because obviously as, neonates and, baby kittens, their immune system, especially in a rescue situation, is generally, at a fragile point. And so the immune blend from my line would make the most sense as just a good go-to match for what you're talking about. It's definitely very different from B12, but it would absolutely make sense to use in that situation, and it would be very safe.
Vicky, are your cats having a problem? Are your kittens sick?
No, it's just a problem from a cat breeder. I'm just handling this case study because it's as in our experience, most of the kitten with cat heat on its side, they can be helpful with the B12 and will resume like in week 4 to week 8. Yeah, but the veterinarian in Hong Kong is not quite happy with the breeder, cat breeder or dog breeder, because they are not supporting breeding. So most of them will encourage us to put to sleep when it's time. But we did see many successful cases with B12. But I want to see if we can help on homeopathy side.
Vicky, I would say my immune blend, and the other thing that I can just share with you is that I do get a lot of feedback from cat parents, kitty parents, that this is very helpful with upper respiratory conditions, which we know a lot of rescue kitties or, kitties in shelters, etc., are exposed to and can have, recurrences, obviously, of these viral infections coming back due to, stress and different triggers. But the immune blend works great for that. It would be a good match for these baby kittens in this type of situation. And I've definitely seen it help cats with viral conditions.
Katie, can she get it in Hong Kong? Can you get it to her?
That's what I was going to ask.
It's in the UK, so I don't know if it can get to Hong Kong. That's a Jessica question. So
okay. And just
yeah, sometimes homeopathy is difficult in Hong Kong. It's difficult to get from the other country to Hong Kong.
Vicky, do you want to be a distributor?
Thank you, Poppy.
Yes, I want to, if I can.
Okay. We'll
yeah,
try to make that.
We'll catch you up with Jessica, and we'll see what we can do.
And Jessica said on Facebook that you're speaking at Helsinki.
Oh, yes. So I am speaking at the University in Helsinki, Finland, with Dr. Anna Bjorkman, who is Rafir's, and she's got a great conference that she's been doing, annually for years. And Dr. Connor Brady is typically there, although he won't be there this year, but he's the one who suggested to Anna that she get me in there speaking. So I will be.
Yay, that's so exciting.
Thank you.
Who wants to go to Helsinki? Okay, anybody else before we call it a night? Dr. Katie, you have been so gracious with your time. Donna has one more question. If you
One quick question. Can we get your remedies in Canada? Is there anybody distributing in Canada?
We are, thank you for asking for that, Donna. We're working on that. So we don't have an easy distributor. We were shipping like individually to Canada, but it is there's so many obstacles for like reasonable prices for people for us to be able to ship there. So Jessica's definitely working on that to find distributorship in Canada so that we can be more readily available there, because I have a lot of Canadian clients too that are like really wanting that.
Well, I have American clients that I cannot ship to anymore because of all BS that's going on. So, but Canadian clients are looking for stuff like this too, and we're having a hard time getting it.
Well, Donna, thank you for putting in that feedback because we are definitely working on it, but that is motivating too, to just really keep.
Yeah,
going.
yeah. Well,
Donna,
if you get a
We're
distributor, I
actually
want to
test.
carry it.
come to California, Donna, with a suitcase.
And
We're
I'll bring
actually
it with
testing.
my stuff. We'll swap.
We're actually testing a Canadian distributor because we have the same problem.
Oh,
So
maybe
if
you
we,
guys
yeah,
can piggyback.
one, yeah, I've been working on helping Jackie get somebody, and she's testing somebody. I think she got it from Dr. Judy, actually.
Oh, good.
Oh, cool.
So if it
Yeah.
works out, I'll let you know, and then.
Well, I'm friends with a lot of the pet store owners, and they know who all the distributors are, so I can always connect you. And because all I need is a distributor, and then I can put it on my website.
That makes total sense. I mean, you need to find a distributor. First of all, as a distributor, you need to find out if you can import Dr. Katie's products. And that's something that has to be done with, you know, all the ingredients, which is a pain in the ass.
Simple though. Her ingredients
Because
are crazy simple.
I send stuff out of country and I know what I can and cannot send, and it's a nightmare.
It is,
So,
yeah.
and then you've got VAT taxes. You've got all kinds of import stuff and shipping. Do you live close to the border, Donna?
No, I'm a few hours away, but I've thought of that because there's
Well, what a lot of Canadians resellers, stores or vets do is they'll have it shipped to like a UPS or a FedEx store or somewhere, one of those postal stores on stateside, and then drive down and pick up whatever the hell they're buying.
Yeah, I've thought of that because there's a lot of stuff that my clients in states can't get from me anymore, and they're right pissed. So it would be all I would do every week would be driving back and forth. It would just
Yeah,
there's
but
just
Donna,
no
we
time.
have a huge Canadian audience. So maybe we can find somebody to be your mule.
Yeah, that's
Sorry.
true.
Like I said, you can feel free to connect us with good people, and you know, something's gonna manifest very soon.
Yeah,
Right
well,
on.
I'm so very grateful, Dr. Katie, for what you've got and what you're doing. So thank you very much for your time.
Thank you, Donna. I so appreciate that. Thank you, thank you.
And Elaine wanted to know about your Vetox rabies, the R. Is there I'm assuming that the instructions come with it, but if there's a little extra instructions, let us know.
Okay, yeah, no, I would, like I said, you could start before if you want to. If you have a really sensitive pet, maybe start before, you know, or if they've had a known reaction. I would start before, but I would use it just with the label 3 to 5 days. So, yeah.
Okay, great. Right on. Oh, this has been so much fun. Thank you for being
Oh, you
here.
are so
I
welcome.
look so forward to this, and you did not disappoint.
Oh, well, thank you. I'm so glad to hear that. And it was such a fun group. Thank you everyone for contributing everything, all the comments, all the feedback, and you know, all the learning. Even I got tidbits out of it. So, you know, what a win-win.
Awesome.
Yeah.
Thank you, Dr. Katie.
Thank you. Thanks, everyone.
Thank you.
Such a pleasure.
Thank you.
See you in
Okay, and then
October.
Friday, you guys, Greg Tilford, we rescheduled for this Friday at 5 p.m. Pacific. So we'll
5
come
or
back
5:30.
5, because I want to go to bed early.
That's right.
Thank you.
Okay.
Be
Bye,
blessed, you
everybody.
guys.
Bye,
Have a great
guys.
Have a
week.
great week.
See you in a couple days.